Hello, my name is Dr. Hillel Mazansky, and I'm coming to you today from San Diego, California. The mind causes all one's physical and psychological ailments. If the mind causes it, which it does, the mind helps heal or treat it using medical hypnosis, guided imagery, nutrition, and exercise. The latter four are my areas of expertise. Please read my new book titled Empower Yourself with Medical Hypnosis, available on Amazon.com. The reader will live a longer, happier, healthier life after reading the book. Today's health tip is titled The Truth About Antidepressants. There are basically two forms of depression. Aside from situational depression, which occurs when one loses one's job or when there are family issues, there are basically two types of depression: major depressive disorder, and the second is bipolar depression. Major depression is characterized by being depressed for a prolonged period of time, for over 3 months or more. Bipolar depression, on the other hand, is characterized by times of depression intermingled with times of elation, or the so-called high of depression. Now, antidepressives are used all the time in both cases. The truths about antidepressant medication are the following. Most of the antidepressants work by altering the brain chemistry called neurotransmitters, such as serotonin, norepinephrine, and more. The antidepressants tend to make the brain more relaxed and helps treat the depression. The drugs can be prescribed either by a primary care doctor or by a psychiatrist. These drugs are highly efficacious, especially when used in conjunction with psychotherapy or counseling. Most people report an increase in their mood, and the feelings of helplessness and hopelessness, which are characteristic of depression, also improve. If after 4 to 6 weeks the drugs do not work, then you should consult with a physician, because there's a large variety of drugs available today that can be used. Oftentimes, increasing the dosage or changing the medication helps. There is absolutely no difference today between using brand or generic drugs. Many studies have shown that they work equally well. You should never quit taking the antidepressant medication without a doctor's approval, as it can cause relapses and you might feel depressed again. Oftentimes, some of these drugs do have side effects, such as nausea, vomiting, and sexual side effects. But changing the type of medication oftentimes helps, and your doctor will be able to assist you in this field. Antidepressants today have far fewer side effects than years ago, and they are generally well tolerated, and the patients do very well taking them. Follow-up care is of extreme importance, in as much as you should not stop taking the medication without your doctor's approval, and your physician can help you decide whether you need to change the medication or whether you need to alter the dose. One myth is that you might have to take the medication for life. Well, in some cases this is true, but oftentimes after a period of time your doctor might do a trial and take you off the medication to see how you function. If you function well, then fine. If not, you can always return to that medication or a different one. Psychotherapy or counseling is very important to be used in combination with a medication, and research has shown that both cases work. Hypnotherapy, medical hypnosis, is another viable alternative, as using hypnosis one is able to penetrate the subconscious mind. Exercise is something that is extremely beneficial for exercise, as serotonin, or the feel-good hormone, is secreted. You don't have to go to a gym. The best and cheapest form of exercise is walking. Begin walking slowly if you've never exercised before, and then as you become fitter and fitter, so you increase the speed. If the weather is inclement in your area, you can always go to a mall and work out in the mall. It is extremely beneficial to take adequate amount of vitamin D3, as research again has shown that many depressives suffer a low vitamin D level in their blood. I recommend taking 5,000 international units of D3 every day, once a day after your main meal. And after a month or two, you should have a blood test to have it checked, as you might need a higher dosage. Your doctor will decide together with you when the time is right to stop the medication. But as I said before, oftentimes the medication needs to be taken for a long time. On my website, drmedicalhypnosis.com, drmedicalhypnosis.com, is a hypnosis video for your consideration regarding depression. My name is Dr. Hillel Mazansky, and I thank you very much for listening to this health tip.